Temperature map, we're still just fine at 55 and we're at 35.6, and people would ask what about those nerves and all that. We don't see any fasciculation here. If we hunted for the nerve, you might find it, but we're not hunting for it. So she's pushing through and she's somewhere, now you see the hot spot is somewhere in about here. It's
So we can't get the temperature greater than 55 because this thing will shut off. Is that
Exactly.
what
It
you're
just pauses.
saying?
Yeah.
Pauses, yeah.
cruise control.
Yeah.
So we're 50 seconds in, we're still at 35. Why are we at 35? Because the upper face is cooler, it doesn't hold as much heat. Right? We all know that when you're walking in the cold winter, your cheeks are cold.
It gets warm.
So now she's way up here. You worry so much about this with lipo, but you don't worry about it much here. You know, the pointing up towards when you're suctioning near the skin, you can cause problems. We're not worried.
You have a smart life?
I try not to tense
They're
in general.
Right.
regulated at 47.
But
You said you did the 10 days sometimes, right?
I do it on purpose sometimes, yeah.
You need to
Yeah,
get higher than that.
and there's reasons when you're trying, you think about clinically, like as a surgeon, what you're trying to do. It's okay if you need to do it. You just have to develop a thermal intuition to go along with your interventional intuition. So we're at 38, we're fine, and this is 55, so we don't even worry about this. And we go back and think of our abdominoplasty specimens and our contraction, and there we are down on the jowls.
And what are you shooting for the surface temperature now?
Well, it's partly we don't care, but there's another way of looking at it. We may say we deliver as much heat as we want,
Reset.
and we try to get it to 42 because that means more heat deep is good.
You have to turn it
We
off.
haven't quite figured that out yet. What we think is that the tip temperature is most important, and
No,
not the skin.
you're going to have an assistant.
And
What? I'm sorry,
in
what?
other words, if I said to
You're
you,
going
we're
to
delivering
have an
55 and
assistant
she's at
with you.
39,
Right,
I say, well, we
So
got to turn it up.
it needs to be reset,
I don't know
then
that
she or
answer.
he will
In
press.
other words, do I have to get it to 42? In other words,
The
do I
elapsed
want?
time's
Do
not
we say
running
she
yet.
needs more heat
Trying
to
to get
get
it
the
to
deep
55?
result?
The elapsed time is running.
Do you want
I
55?
don't know that.
Oh, it is?
So then we say, okay,
no,
so
When I
Yeah.
start, yeah, when
Oh,
I
you have to
start.
start, it
I
starts at when it feels
Making the skin
the
tense.
I
correct
just start at
heat.
55.
Wouldn't it be logical
starts
that
at
you would?
55.
Get regulated
But it goes pretty quick.
So
the
But you had your
temperature
foot on the
warm
pedal,
foot.
and then once it hits
Yeah.
55,
The,
And then it starts time.
why do you need to reset it
absorption of heat,
over there?
not
Why does some?
It's
Well, they have it on
a good
cycle,
reminder
2
of you don't need to heat so much.
when we finish this cycle, we're going to leave the tip in there and watch the temperature drop.
Just want you to
And we're going to do this.
40.4.
So, hey everybody, listen up. Listen up. We're 52, 51, we're 35 seconds into our second cycle. Look at the jawline, margin of the mandible, everybody's worried about that. We're at 40.5, we're starting to get a little warmer, that's fine. You know, even if we're at 43, we're fine. We're really in a safe zone. There's a cycle that says fault 13. We figured out the other day, Kevin.
This is corrected in the next software.
What does that
mean?
It just it's a wig out on the software.
The temperature just went up temporarily for a second.
I'm gonna go ahead and tap you start. Go ahead and
See,
tap
now,
to start.
I want everybody to look for a second. Hold on. It says 80, so stop it. The temperature defaults to the nerve
So
setting
you're on.
because it's approved for a nerve.
Just lower-
So
lower
we
the
have to
setting.
take it.
Yeah,
everybody
I'm
listen.
lowering it.
Hang on, Kevin. It starts at 80. You've got to turn it down to your temp when you're not doing nerves, when you're doing the tissues. So it
You're
turns
on.
on. You'll go to 80. You have to press it to knock
You're
it
on.
down. So we take it down to 55. The temperature cooled off to 42 in that time that we were fussing with the machine. So in about
We increase
a
it.
minute, it went from
When we
55
turn
to
it on, it
42.
starts at 80.
The skin was still at 39, so I wanted, at the end of this cycle, I want
The
to
next
keep
software
everything
does that.
still.
The machine doesn't keep track of how many cycles you've done. So
We're not accumulating data
No.
on this version. Every time you change the the FDA.
You're
will
writing
tell
down
you
how
to
many
get
passes
reapproved.
I've done and how many
Yes,
minutes?
yes.
Okay, fine.
So 57 stops heating, 56, 55. It may undershoot 54, and then it goes back up again. Stafford, so you see the power is. We don't have the power fluctuation with an indicator. We could. 26 seconds, and now we've heated up that whole area. We're at 39, and see, even at 55, we're fine.
So when you have a fault like that, you lose the timing data too.
So you just have to remember.
Yeah. So we have to kind of keep that.
Oh, that happened at 30 seconds. Okay, we'll do a minute and a half,
Yeah.
and then you reset it.
But you have to reset it yourself, it'll automatically shut down, or?
No, you get a fault, it'll shut the current off, and then if you get a fault 13, you got to turn the machine off and
Okay.
on to reboot. It takes about 2 seconds. It's not long.
This software version was designed for a stationary cannula. So when it's moving, there's a lot of different calculations going on, and once in a while it just gets confused and shuts off.
Yeah, because
40.
when you're, yeah, we're
You're
fine.
good.
Yeah.
Yeah, very good.
It usually happens in a high impedance. She's at 280.
Which means drier, which means
Yeah.
injecting a little less there.
What would be the maximal for skin temperature that you found in your studies?
Well, if you look at the
Where
data,
you start to see vesiculation or some,
well, it doesn't correlate with temps. It correlates with
correlate?
proximity to the nerve. In Doug's study, he was at 46.
No, I'm talking about for skin ulceration.
Oh, wolf.
And what temperature?
What temperature on
What
the
temperature are
skin?
you burning the skin?
That's right.
It's around 49.
49, yeah, way up there.
Okay.
And Dr. Halaas is so safe right now. I mean, we have aggressively treated people where skin temps will be 43.
Okay, so
There's
you
that
wanted me
triple
to
B.
stay in the skin, and what did you want me to do? You want me to stay in the skin?
So we've
Should not come out?
we've done two. You stay there. The temp's already down to 41. It'll drop now. Okay, there's no temperature gradient. Skin's at 41, inside's at 41. And if we sat there and did nothing for the next couple of minutes, they both would slowly over 5 minutes. Dr. Goldblatt.
Oh, wanted to see how long it takes.
Yeah, she left the room. We did it. Sorry.
Okay.
But you know, how long will those temps stay there? 3 minutes, 5 minutes, whatever. So now look at that. Internal's 39, skin's 41.5. Why? It's radiating out. A minute ago, it was deep 42 and internal 40. Now the heat's coming out. But you can't see maybe she's a little pinker here than there. But you see how the temperature is inverted? We can start again whenever we want. I just wanted you to see that. You can actually register the heat going from deep to superficial.
Let's see, how many times have we heated this area?
Is that 4 minutes?
4
I think
minutes?
we've done 4 minutes.
6 minutes. Yeah.
That may be enough.
That's probably enough.
So then we can go to the midline neck, right?
Now, you said something about, the questions you asked, you burn the skin on the inside.
Still with me?
If the external temperature.
We're gonna go into here now, so you're gonna be
49 to 50,
upside
right part.
down.
Okay.
Upside down. Awesome.
When you're doing your nerve,
Those are cheapies from the meeting.
No, I know you're
when you're
a
doing
cheap
your nerve
date.
ablation,
So actually,
you're
no, I'm not
setting
even
the
in.
probe
Whoa,
at
whoa, whoa, whoa.
85.
Not even in.
Yeah, and you're
I'll
not, but you're not
accept. Here
moving,
we
so
go.
that the cruise control doesn't have a lot to do. When you're moving, it's stopping, starting, calculating, stopping, starting, calculating. When you
go.
hold still, it just delivers heat, and it's really easy when you're not moving to get 85 and hold it there. It's very steady.
And you're also not holding it for very long. You're holding
1
it
minute.
1 minute.
So you're doing your nerve ablation, 85, 1 minute in an area.
You don't move. You don't move.
I'm moving.
Okay.
Perfectly
You
still.
okay?
You ever see depression?
She's tired. She's okay. She's sleepy.
Okay, good.
I mean, one day, probably
How
will.
long
Not
do you
yet.
do that? 2 minutes, 4 minutes, 6 minutes?
I mean, that's a really good
Central
point,
zone,
though.
maybe 6.
Yeah, usually 6.
So you do 6
Could
from
you do
this entrance and 6 from that entrance and crosshatch, or how are you doing that?
You're below the
Have a
muscle.
lot.
That muscles are great.
I don't know.
4 and 4.
Or in 4 or 8
So
minutes, maybe.
you do it symmetric,
Yeah,
and
typically.
you'll
You'll
do it
see,
all at once.
it's going to take me 4 minutes to get this whole thing done.
This is a pretty small area, so 8 minutes, 4 and 4 is a fair amount. This area is smaller than the lateral neck.
So you're doing
I
4
am
this
going to
way
do. I am
and
going
then
to do a
4
little
this
bit
way?
this
Yeah,
way.
4,
But
4.
it's just awkward. So I think it'll take a little bit more time.
If she had 5 more cc's of fat in there, I might
Do 6
crank
Say
it
to
up to higher.
cook it a little
and
bit.
also higher
you'll-
temperature.
And go deeper.
This goes
We have
faster.
2 tips, 5 millimeter, and we're soon going to have a 10 millimeter tip for that.
And you just do it with one person. You just get tuned.
5
You're looking at
millimeter, about 5 or
actual
6
temps.
inches.
The temp, and then move on.
Closely
Yeah, you want to cut what we're doing now and basically in half, if not more, in terms of treatment time. We're doing a lot of talking and chatting
Right.
Well, it's good.
and stopping and showing, of course. Very good. Very
It takes
informational.
twice as long in a teaching session as normal,
Right.
at least. Priscilla's putting up with us.
So it's good. So it's great.
After the procedure?
We're going to show you some more stuff too.
I know, I just have to change my reservation, and I'm changing. All right. So I'm stepping, that's why I'm stepping up. I just
Got it.
gotta call and move back.
No problem. So now we're laying down this triangle. You can see Dr. Halaas, he's got it, starting to get a nice result.
What do you mean by a triangle?
there, you'll see, she's doing a fanning. So she starts inferior, and then she's pulling back, and then going up a little, pulling back, up a little more. And she's going to end up at the margin of the mandible. The triangle is starting with her hands over it. As soon as she moves it, see it? She's starting to get a triangle there.
Oh, I see. It means it's V.
The heat, yeah, the heat pattern.
You mean
and
a
it will
V.
slowly, yeah. So,
You're calling it a triangle, but it's
That.
a V. It's a V.
well, yeah, because the other end of it
Right.
has a temperature zone at the tip.
Right, okay.
So you'll see, Dr. Stafford, you'll see that it took me 2
When
minutes
she's done, it'll
just
be a triangle.
to do that, so.
You're positive. So blue light here,
Thank
when
you.
it's on all the time, it means you're active. Beep, if it's blinking, you're paused.
And you'll hear that beep every 5 seconds. It said 10, but it's 5. On off.
On and off, yeah.
Yeah. And if you don't reset, it won't initiate. That's, right now, that's a ergonomic safety thing. Okay, so that says warning 3. And that,
It's taking
Just
too
means-
long to get to 10, so.
Yeah.
you have to hold still. It says, hey, I didn't reach the temp.
I had my hand on it because I was
You
trying
set a
to
temp,
stretch her
and
out.
then you say, hey, I'm not getting there. What's wrong?
Go ahead and try it
beeps.
again. So you want to stay stationary, pointing downwards, until it starts the clock.
Later software versions will not say warning 3. It'll have a verbal warning. Warning, you haven't reached temp. Right now, it's engineer-based and not aesthetic and
It's paused.
functional-based.
Unpause me.
You're paused.
I'm trying to unpause me. You paused me and I stepped at the same time. Okay, now we're good. One or the other.
Keep dancing.
So if you don't reach your set temp within about, I think it's 18 seconds, the machine will let you know.
And when we were doing the lipo motion, we were going into cold zones, not heating up.
So right
Well,
now it
after
actually
time.